We're learning about a strange new side effect associated with COVID-19. Right now, new evidence shows some patients who battled severe cases of the virus are getting so-called nodules on their eyes. Let's get right to it. Here's the buzz. This is basically an area of inflammation, and doctors say they're seeing this in patients who were placed face down in the hospital to help them breathe better. Experts are now trying to figure out if this causes vision loss. And with so many people still waiting to get the vaccine, this may just come as a shock to you. Many vials contain leftover vaccine once the 6 full doses are given out. But under FDA rules, clinic workers are forced to throw the residual vaccine in the garbage. Now, some are calling for vaccine pooling, which is where they combine the residue from multiple vials to make additional full doses. The FDA is currently not allowing it to prevent contamination, but pharmacists say they frequently pool other drugs, and there are already safety measures in place to do so. So is that a change that we could see in the future? Possibly, and that could save thousands of potential doses.